Doctors of Reddit, what are some moments that made you wish you had never became a doctor? We had a new student come and do rotations at our hospital, and being new I had the honor of supervising her first digital rectal exam. As soon as she inserted her finger, the patient proceeded to evacuate his bowels all over her hand lab coat, and she began vomiting all over the patient. It was hilarious and disgusting all at the same time. Watching children die. Torturing the 90+ end-of-life patients because their children are unreasonable and don't want to let go. Teaching new interns the same bulls every year. Watching all the malpractice that goes on around the country. Torturing the 90+ end-of-life patients. I work as an EMT. Last week we picked up a 97-YO who was altered. She had a DNR and DNI on file. The son was there and he was the proxy. He wanted us to ignore the DNR/DNI if she coded during transport. I tried explaining what we would do and how that would not help her go against her wishes. He ignored me. I cannot imagine the stuff you have to deal with. I had a 9-year-old girl brought in one night with her parents complaining of fever and respiratory distress, presenting with coughing and wheezing. The kid was really out of it and the parents were very upset. I thought it was bronchitis, but I admitted her and ordered treatment for her fever and cough as well as throat cultures. I was with another patient when the kid started hallucinating, sobbing and spewing everywhere. I figured it had to do with the fever, so I packed her with ice, but she died maybe a half hour after that. This wasn't my first death, but it was one of the worst. I couldn't tell the stiff neck since the kid was out of it. She also couldn't tell me anything else that would point to simple or complex seizures. She died of Neisseria meningitis. Completely wrong diagnosis. To make matters worse, we called in all her schoolmates and anyone else we could wake up just in time to see 3 other kids go. The rest got antibiotics quickly enough. Probably my worst day in medicine. This is one of my favorite stories from my mother. She has been a doctor for probably around 30 years now. When things go wrong with patients, she takes it hard. The experience that sticks out to her happened when she was in Russia. She is an American, but went abroad to do some volunteering. She met a young girl living on the street who was very ill and, at the time, around the same age as me, her daughter. She had no family, no money, no food, nothing. My mother treated her as best as she could and spent several days playing with the girl and keeping her company. This girl was so grateful she insisted my mother take her only possession as payment, a ripped plastic shopping bag. My mother initially refused, but eventually they agreed to tear the bag in 2 and each keep half. My mom never really wants to talk about what happened next, but I do know when she went to find the girl again a few weeks later, she had passed away. My mother was devastated. She keeps that ripped plastic bag tied onto her stethoscope and about to this day. Makes me sad when I see it. My mom says she learned to not take her ghosts with her, but that one will always stick. By far the saddest story I've ever seen on Reddit. Not my experience, but my mom's boss. He became a doctor and was getting overall fed up with it. One night a homeless person came in that was covered head to toe with lice. They put him in some kind of dunk tank, but the nurses were running around dealing with other things and the guy drowned in it. He left the profession and went back to school to become a lawyer. He got fed up with everything involved with that and went to work for OSHA. My mom said he was the most caring boss she had there in over 30 years. What a horrible way to die. 1. Starting residency and realizing your work schedule is pretty much set in stone for at least the next 3 years, and you only get 4 days off per month. 2. Feeling the stress of loan repayment, watching as about $10,000 of interest is capitalized each year of residency on your loans. 3. Chronic stress from knowing that your actions and decisions that you make affect whether or not people live or die, even at the earliest part of your career. Looking back at decisions that you made and wondering if you had done something different, would that patient have lived? 4. Having to tell strangers on a regular basis that they are going to die, or their parent's spouse is going to die, or worse that their child is going to die. One of my quasi-elderly patients had terrible bladder control issues. Pills didn't work, and surgery was not an option, so I refer her for a pessary, which is a rubber donut-shaped device placed in the vagina to lift the bladder. She came back in a few months later with pelvic pain, and it became obvious the referring doc wasn't clear about her need to remove it monthly to wash it off. We get her in the stirrups, covered with a sheet. I sit down, not realizing how much wafting that maneuver would create, until the smell hit. My eyes began to water as I held professional composure, and it looked up at my nurse, who was clearly also dying just a bit inside. Time for the speculum exam. Words cannot describe how bad the yeast and or pus was. White goo covered everything, and was oozing out like molasses. Just get in and get out, I thought. But no, the pessary would not come out. I had to stand up, stabilize my footing like I was in a tug of war, and reached in with just a couple of fingers. I got around the edge and pulled, and that sucker was stuck. Finally, as the seal started to separate, we heard a grand sucking sound that even the semi-deaf patient heard. There was a bit of blood, and the mixing with pus yeast reminded me of strawberry quick, but we got it done. She chose not to have it replaced, ever. TL. Dr. Nope. You gotta read it to believe it. Well, med school final year here. It's just the misery you see every day. Small children dying. Old people they're in the hospital beds where no one is by their sides. And since I am from India, we see this gloominess on the family's face when we break out the news that they just had a baby girl. They are so excited about the delivery otherwise, but as soon as you tell them it's a girl, they make such a horrid face and tell you to get out of their face. This when you face almost every second day gets you so mad that you wanna break their heads but can't do anything. That is the time I regret being in training for being a doctor. Nothing has ever grossed me out enough to make me wish I had never become a doctor. Pee, crap, vomit, tissue necrosis, pus, whatever. I knew what I was getting into. Nevertheless, about 9 months ago when I reconsolidated my loans and saw how much I owed total and what my monthly payments would be, I banged my head against the desk and thought to myself that I should have been a plumber. As a GP I have it pretty good, and I can honestly say that I am satisfied with my line of work. I'm glad I wound up in medicine. I love talking to patients and don't have any regrets. Having said that, I trained in NYC, and it was very hard to be working on weekends and evenings when everyone else was out partying. You could see Greenwich Village from our hospital, which didn't help during those stressful night calls in the ICU. Once, as a med student, I got up at 4 AM on a Saturday to take the subway to the Bronx for a surgery rotation. Walking to the train, I passed a diner that was packed with people. I wondered why it was so full at 4 AM. Then I realized, it was still Friday night for those people. My father responded with, when I realized someone had to take care of problem hemorrhoids on Christmas. Edit. Liberal arts student here. Can't spell anything medical worth crap. Well, my brother, a 4th year med school student, recently told me an experience he had to deal with that made me question whether I could handle being a doctor. 4 19-year-olds came in after a horrific car accident. They were all drunk, including the driver. The first guy was pronounced dead on arrival. His chest was completely caved in. The second guy's head was just a pulpy mess and they had to sedate paralyze him so he wouldn't flail and further screw up his skull. The third guy had to have his chest drained after massive internal bleeding. And the fourth, a girl, somehow got caught under the car apparently and her pelvis and femur were completely shattered. Granted he wants to be an ED doc, but man, I've always wanted to do pediatrics. And while I may never have cases as gruesome as this in pediatrics, I might have a patient die, a child that you witness grow over the years. I have been rostered to the bone marrow transplant unit for the last 10 weeks and it has been the most miserable weeks of my life. Our patients die often and are usually reasonably young, age 16-60. They have terminal hematological cancers and usually the transplant is their last hope of survival. 1/3 die in the first few weeks, 1/3 do well and 1/3 have horrible chronic complications. The thing that gets me the most is that they fight the bravest, most courageous, excruciatingly painful battle of their lives and frequently lose. To see a patient with multiple infections, destroyed joints from septic arthritis and bloated and distorted from 10 kilograms of extra fluid on board endure excruciating pain for 2 weeks only to die in the end. It's heartbreaking. Often I go home and cry. 4th year medical student here. Last week, I had to do a pelvic exam on a gross 20-year-old with a horrific gonorrhea chlamydia infection. FML. Doctor here. My list. 1. Listening to patients addicted to pain meds beg for more. 2. Ordering labs that are not medically necessary but my family member read on the internet. 3. Listening to colleagues complain about Obamacare. 4. Patients who won't take their medications but will take every supplement known to man at GNC. 5. Hospitals that transfer patients to us that could easily have been cared for at the smaller facility. 6. Family members who think Aunt Sally, who had a stroke, has heart failure, is 90 years old and is intubated, should still be full code, i.e. that a good outcome is still possible if CPR is needed in this case. 7. Letting insurance companies dictate care, which I don't allow. The list goes on and on, but I still wouldn't trade it for another gig. Helping patients truly in need is very rewarding. Cheers. But this St. John's wort isn't a chemical man, it's all natural, and that has to be better than this highly researched other medication. When I was a junior surgical trainee, called to emergency to see a homeless guy complaining of foot pain, likely ischemic limb. He was wearing boots. In order to examine the foot I had to take the boots off. Pulled really hard. Boots wouldn't come. Kept pulling. Heard a crunch. Boot comes off. Maggots and liquefied flesh pour out. Leg stump with protruding bone. Waft of pure necrosis fills my nose. Ran out of cubicle. Vomited. Became a radiologist. Ington here. I work in the ER of a government hospital. I get a lot of ungrateful patients wanting special treatment. I have to explain calmly that I attend to those with life-threatening conditions first. My hospital is a trauma center encircled by depressed areas, so we get a lot of patients. Should put up a sign that says, those with life-threatening conditions will be treated first. If you don't have a life-threatening condition and insist on being treated first, we will provide you with one. My brother is a doctor. One day they brought in a dead body for an autopsy. He recognized the girl as an old friend of his. Also, he delivered both of his children. I don't know why would anyone want to see his wife's vagina get destroyed. When my wife has babies, I will be noping nearby. Side note, my parents are also doctors. Everyone was in the room. Sometimes, even I don't understand my own family. When it is your kid being born, your wife's vagina means diddly jack crap. I was surprised to see this thread filled with gross out stories. I've seen my fair share of funky and smelly things, and been sprayed with fluids I didn't know existed before medical school, but I expected that going in. That may have directed me away from certain fields but not from medicine. The moments that make me wish I never became a doctor are the flashes where I see the true job landscape out there. I will not have the option of getting the job I want, won't be able to work where I want, and won't even be able to start working as a staff doctor until I pull off a couple of additional years of fellowship to be competitive. After chugging through medical school and putting in 80 hours weeks in residency, there's no pot of gold at the end. I'll be graduating soon from one of the most world-renowned radiation oncology departments in the world, and it's no help. In Canada, the unemployment rate for recently graduated specialist physicians is higher than the national unemployment average. In my discipline, it's about 50%. The issue isn't that I'm picky, it's that there aren't jobs. People are doing huge amounts of extra training to get competitive for when that one spot opens up, and all we want to do is treat patients. Try explaining it to others too. That makes me wish I'd never became a doctor. Every conversation someone says, frick it, you're a doctor, you'll be fine. But I can't easily find a job in the same city as my parents like you can. My girlfriend will have to give up her job to come with me, and I'll be stuck in my 30s looking across North America for my first position. My friends working the oil rigs, if they haven't wasted it on H and blow, should be $1 million ahead of me by then. Those are the moments. I love what I do. I truly love it, and it's an honor to do it. But if I had any idea what the job situation was really like, I would have done something else. Many people say if they won the lottery they'd take care of their friends with new cars and junk. I tell myself that if I ever win the lotto, I'll try to get a few more doctors and specialists to move to my town. From numerous comments in this thread, it seems that paying off student loans would be a major enticement. I'm very new, but I think missing something is the worst. I had a terribly sick guy develop severe edema. I shut off fluids and gave him Lasix. He was having a severe heart attack. No complaints and no chest pain. He died overnight and I felt terrible. My attending reminded me he had a brain bleed anyway and we wouldn't treat the heart attack anyway, but I still missed it and it still got to me. He was old and had terminal cancer, but I'll never make that mistake again. He was doomed, but you helped and you tried. Ultimately that's all that matters. This is a story my father told me about his residency. One night, while he was in the ER, the paramedics brought in a girl who had been assaulted and had her eyes gouged out. He said they brought her in, handed him her eyeballs, even though it is impossible to reattach eyeballs with severed optic nerves, and left. Later that night, members of a rival gang of which the aforementioned girl was affiliated with, returned to try and finish the job. I trained and work in Australia, but I have worked a stretch in a tertiary referral hospital in Southern Africa in a resource-limited setting. One afternoon I admitted a 20-year-old man in severe respiratory distress, likely PCP pneumonia. He presented way too late and the policy in that hospital was that patients with HIV did not go to the ICU. There was nothing we could do, and all I could think about was what I would be doing if this poor guy was in Australia. Universal healthcare is fantastic. As it was, I admitted him to the ward and watched him die over the next few hours. I am a final year medical student, so not yet a doctor, but my first urinary catheterization is a story that usually gets a lot of laughs. There was an elderly gentleman who presented with severe urinary retention. He had not urinated in several days and his bladder was so full of urine you could feel it, about the consistency and size of a softball. When palpating his lower abdomen, the nurses asked me if I wanted to catheterize him, and as a typical eager and overconfident third-year student I gladly accepted the challenge. After inserting the catheter and draining some of the urine into a small collecting dish, I went to connect the catheter to the catheter bag. Stupidly, I pointed the catheter upwards, staring at the opening as if I was staring down the barrel of a gun. The patient then proceeded to cough, resulting in a torrent of urine shooting out the end of the catheter and all over my face. In the moment, I was pretty disgusted, though I won't say it made me wish I wasn't pursuing the career I wanted. It did, however, influence me to pursue pediatrics rather than working with adults. For the rest of my time working on that ward, I received quite a lot of laughs from residents, nurses and attendings. The silver lining is that it provided me with a great story to tell people when they ask me what it's like to work in the medical field. Watching helpless how the spawns of some of my patients absolutely destroy my office while I'm trying to do my work and their parents don't even bat an eye. Sometimes I go postal in my mind just to vent a little while reviewing their medical history and finally calm down when I realize that I only have to tolerate them for as long as they're there, not my whole life. One of my colleagues, who was a fantastic physician and good friend, committed suicide last year after being struck off the register after he was found to have been injecting ketamine on a regular basis. This made me think about how stressful the job is and how someone who I respected so much and someone who was really progressing the field could find themselves in a horrible situation. I'm not a doctor, but I can tell the story that made my mom go into medical billing rather than becoming a nurse or doctor. She was working as a medical assistant when she was in her late teens and early 20s and planning to go into medicine. Her employer was this elderly Italian doctor, really old school in terms of technique and attitude and kind of a badass guy despite his age. One day, she checked in a woman who had recently had a mastectomy performed. When the patient came in, the smell emanating off of her was palpable and she was visibly dirty. My mom put her in an examination room and brought the doctor. The doctor started unwrapping the bandages around this woman's chest. With every layer, the smell grew stronger and more nausea-inducing. It was clear the patient hadn't followed the directions about changing her bandages at home. The doctor finally reached the last of the bandages and yanked them off. The source of the smell became instantly obvious as maggots started pouring out of the patient's chest. The doctor started shrieking and slapping the maggots off of her, screaming at my mom to help him, though neither of them really knew what the best course of action was right at that point. My mom tells the story with fondness, but it was that incident that made her go into the bureaucratic side of medicine rather than staying in the trenches. If they were fly maggots, they only eat the dead tissue. They were helping. I'm a PA in ENT and I'm pretty happy with how things turned out. I assist in surgery and get to do some relatively simple office procedures. I work 40 hours a week, one half day, Friday, which is awesome. No weekends. No call, major holidays off, get to help lots of folks out, buzz weird things by my attending docs, who are alright. Student loan sucks still. Like said earlier, older practitioners seem to have skated through the inflated tuition and banked more money, a golden age, as said by some of my peers. I have roughly $100k in student loans. Kind of wonder what the difference would have been money-wise if I would have stayed as a medical technologist, CLS, making $60k. All said and done, I'm happy where I'm at and would recommend it still. Here's to hoping the student loan bubble collapses. Cheers. I'm a pet groomer. Groomed my very first cat not too long ago. She died in the cage while drying after her bath. According to the vet, she had a panic attack. I will never groom another cat again. Not a doctor but did a stint as a cornea recovery tech for a few months. Basically the job is to harvest corneas for transplants or medical research. This happened to my boss. The first night he went out by himself. After training, he had to go to a morgue to operate on a young woman who had got in a bad car wreck. College town. Heavy drinking. Ran car into tree. Ejected through windshield. The young woman's face had been partially slewed off, along with the skull being split in half. He had to hold tape the skull back together so he could remove the corneas aseptically and properly. The worst part? The young girl's phone was ringing in her pocket the entire time. This was from her friends, calling her to see where she had gone. Only my boss, the girl's parents, and the doctors knew she was dead at the time. Gladly didn't experience any of that myself. Not quite sure how I would have handled it if I was in his place. I've been a doctor for 3 years now, so I'm relatively new to it. For me it's when you're 71 hours into a shift, have had about an hour of sleep and are called to review someone that's acutely unwell. You'll find yourself not caring, purely from fatigue, and at that point you'll hate yourself and the job that's making you become what you've always hated. I'm happy with my current career as a radiologist. There are some very sad stories though. It helps that most of my friends and my partner are all doctors, so we all thrash out the difficult stuff together. Radiologists are awesome. As you get older and more distinguished, you can make the connections to start working from home still as a radiologist if you wish. My father has been a radiologist for 40 years and currently he works from home in a system where he is sent a set of x-rays, writes a report on those x-rays, and sends them back. I am not a doctor. I know it. But I work on medical malpractice suits from the legal side. I have always thought it must be very difficult to do everything in your power and still have things go wrong, and then get sued for it. I work on damage quantification, so I don't usually read the medical report details because it isn't relevant to my report. But since I'm a parent who suffers from morbid curiosity, I sometimes look through when I see the date of birth is the same as the date of injury. I am amazed how often I read through a statement of claim where the doctor's actions follow all the standard procedures for a complicated birth. Emergency C-section, use of forceps, all of them have risks. Sometimes bad things happen. I think it would be difficult to have a close call, save the patient, save the baby, but then be sued because either mother or child or both were injured in the process of saving their lives. Not me, but my dad has been a paramedic for over 30 years now. He's said there's things that you'll never shake from your memory. Things like being called on a beautiful Saturday morning for someone who killed his wife and kids with a hammer. Hospital work is tough, emotional work. But sometimes I believe first response is harder. Being at the scene must have a whole other sense of horror than seeing the patients come in and imagining the scene. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.